Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. The links for which is given in the description box below. And today, in conversation with me on the Tooth Talk, I have Dr. Subhash. To give you a brief
Hello.
introduction about Dr. Subhash, Dr. Subhash did his BDS from the Oxford Dental College, Bangalore in the year 1998. He did his post-graduation MDS in Oral Medicine and Radiology from the RV Dental College. He has a PhD in Oral Medicine in the year 2016 from the Rajiv Gandhi University of Health Sciences, Karnataka. The research was on temporomandibular joint disorders. Dr. Subhash is currently working as a faculty in the Department of Oral Medicine and Radiology at the RV Dental College, Bangalore, since 2009. He is the assistant professor in the department. On a professional level, his areas of interest include temporomandibular joint disorders, ultrasonography in maxillofacial imaging, tobacco cessation programs, and salivary diagnostics, etc. He has visited Showa University College of Dentistry, Tokyo Dental College, and Niagara University for training in advanced imaging modalities. On the personal level, Dr. Subhash loves traveling, farming, and collecting coins. Dr. Subhash, thank you so much for joining me in today's To Talk with Your Dentist conversation, and a warm welcome to you.
Thank you, Rekha. Thank you. And it's a pleasure to join this channel.
Thank you, Dr. Subhash. Thank you so much. So, you have mentioned in your research and in your specialities that ultrasonography and these kind of diagnostic aids that are used in dentistry. So, if you can very briefly tell our patients and our viewers what exactly are the kind of diagnostic aids that are available and why it would be recommended by a dentist to his or her patient.
Basically, imaging forms the third eye of any doctor, for that matter. It could be a medical professional or a dental surgeon, because it gives you the third dimensional, concept and the perspective, so that your diagnosis becomes clear. And usually, the surgical procedures, usually dentistry is nothing but surgery. It could be
Yes.
bloodless or with blood in the field, but everything is surgery because it has a precise work. So when we are into any procedure, we would like to get as much information as possible from most of the from the patient. And one way is clinical examination. Yes, it just gives you two dimension, but I
Yes.
would like to go into the tooth and see till where the disease process is, and how far is my tooth from the vital structures, and whether it is a soft tissue related issue or a hard tissue related issue. Has it destroyed the bone completely or partially? And what is the amount of bone I have to put a prosthetic implant? All these things are uh, 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 given by this imaging modality, the different scans. And the advent of technology has given us an array of scans to
Yes.
choose from, and it has made a dentist job easy and
Yes.
patient's experience of dentistry painless.
Painless. Yes. Yes. Dr. Subhash, I think most of our patients are aware about dental X-rays that
Yeah.
usually we dentists would take. So,
Yeah.
if we can first come to this category, what are the types of X-rays that are available, and why would it be recommended by a dentist?
Okay, see, X-rays is a layman term. Actually, we call it as radiograph. But for a common man, it's always a X-ray, because they use X-rays, a type of electromagnetic radiation, just like a visible light. It's also a high energy radiation source, which will go penetrate into the body of the patient and get the information which we can't see with our eyes. Okay, it is going into the internal structures. The most basic radiograph or X-ray for that matter, what we take in dentistry is intraoral X-rays, which I think most of the patients would be aware of. It's a small rectangular piece of film on which 3 or max to max 4 teeth are imaged. And this gives a very clear picture of initial dental caries, that is cavities, which are at a very initial stage. And it gives a very clear picture of fine changes which happens in the root tip. Okay. This information is very much essential for us to decide whether a patient has to go for a root canal treatment. If it is root tip is changed, then he needs a root canal treatment. If root tip is intact and if it is just a deep cavity, then we would like to wait and watch, like do a temporary restoration, wait, and then do a permanent restoration. So this becomes a very big decision making thing, because root canal treatment is a totally different game when compared to just a filling. So usually dentist will advise a small intraoral X-ray to analyze this thing. Okay, you need a better coverage, then we have panoramic X-rays, where the entire mandible and that is lower jaw and upper jaw along with the joint is imaged in a single film. This is a beautiful invention according to me, because it gives you an idea about the entire dental arch. Is there any hidden decay? Are there any fracture lines? Or is there any hidden cyst or a tumor developing there? So all these information you will get, that's why it's called as panoramic view. That is panorama. It gives a very wide view of the jaw. And though the limitation is it doesn't have the clarity what a small intraoral X-ray can give. So if there are multiple teeth with involvement of dental caries, if there are some blocked teeth within the bone, we call it as impaction. If there are any missing teeth, we need to see the position. Then we go for a intraoral X-ray. Then if we want a panoramic view, then the dentist may ask for a panoramic view. Apart from these two common things, we have other skull radiographs, that is skull images, and we have occlusal radiograph, that is it is kept inside the mouth with a bigger view of the entire maxilla or mandible. These things will give us an additional information which is not shown by these radiographs. But skull views are quite rare. Intraoral X-rays and panoramic views are the ones which are commonly taken to assess, to have a initial assessment of the dental arches.
Okay. So, Sir Dr. Subhash, will there be any other types of X-rays that would be recommended? Say, if a patient is undergoing some kind of a clip treatment, so would there be any additional things that their dentist might recommend and tell them to do?
Yeah, usually for a clip treatment or braces or orthodontic treatment, the first set of radiographs what we advise is intraoral X-rays to see the fine bony architecture, panoramic view to give us general information about the arch. But in most of these patients who undergo braces or clip treatment, their lower jaw or the upper jaw would be forward or backward, with the, we call it as crowding, that is overlapping of the teeth. So how far it is forward or how far it is backward, this information can be had only with one type of X-ray, that is the lateral view or the side or profile view of the face. We call it as a lateral cephalogram, and this will help in assessing the, what you call the profile of the patient. Thereby a lot of analysis, we call it as model analysis, they do on these radiographs that trace the landmarks and measure the angle, distance. So many things goes into planning orthodontic treatment. So lateral view is one thing which a dentist can advise depending on the problem.
Situation, depending on if the patient's requirement is there, and if he feels he needs additional information to go ahead with the treatment planning, then he may ask the patient to get this kind of an X-ray done.
Yes, usually lateral view, panoramic view, and IOP, that is intraoral radiographs, are a set of 3 radiographs which usually every orthodontist would like to see. Of course, now we have advanced imaging like CBCT scans, which will give us all this information in one single scan. That I think will come to it later.
Yes, yes. So, Dr. Subhash, you were saying about the CBCT scan. So, if you can just tell our viewers, why do we generally recommend? I mean, I think they could have heard about this when they undergo an implant treatment. You know, then we say you need to get a scan done. So, what exactly would this be used to assess?
See, CBCT scan is a kind of a miniature CT scan, I can call. In a CT scan, lot of body structures get exposed to the radiation. There is unnecessary exposure of which doesn't require patient. Sorry, the dentist doesn't require information from that area. Still, it gets exposed. In a cone beam CT, that is CBCT, the beam is shaped in such a way that we can focus the area of interest and get the information. I want only the lower jaw, the last two, three teeth, I can focus it. If I want both upper and lower jaw, I can focus in that way. We have something called as field of view. That is, we can select the area what we want to see in a machine and we can take. So these CBCT scans, it is very popular among dentists and general public for assessment of implant sites. That is, if we want to go for an implant, then we would like to know the bone quality. That is, not only how much of bone, but also we would like to see how is the bone, quality of the bone, calcium content. Indirectly, we have various softwares to reduce the bone quality. Then we have quantity of bone. That is the
Thickness.
upper and lower limit of the implant, what can be placed, the width of the implant, what can be placed, and the centering of the implant with respect to the arch, that is towards the tongue or towards the cheek, the centering of the implant. So these three dimensions will be very clear in a CBCT scan. Apart from implant surgeries, this CBCT scan is quite often asked for in, I think, wisdom tooth removal. That's one of the very common usage of CBCT scans, because the panoramic view will give us the wisdom tooth position. But one problem with panorama is, again, it's a two-dimensional image. It cannot give us the information about the root of the wisdom tooth and its relation to the nerve canal. This is a very important information which a surgeon will require while taking out your wisdom tooth. So that precise information is given by a CBCT scan. Apart from these two very important indications, we have in orthodontics, that is in braces, they would like to do analysis like I told you about the cephalogram. In the same way, they do analysis with these scans, and about the missing teeth or the teeth which are just about to erupt into the oral cavity, the position, and if there is an impacted tooth, how far or how close it is to the next vital tooth. So these information is very important in braces. And of course, in trauma, that is, patient has a road traffic accident or some kind of accident where he has injured his jaw, we can have an initial assessment by seeing the entire skull view where all the fracture lines are visible. Yeah, so these are some of the important usage, or a dentist may ask for a CBCT scans in these situations.
So, Dr. Subhash, what are the types of X-rays that the dentist himself will be able to do, and generally, what are the X-rays that he will ask a patient and send him for a referral to get it done?
Yeah, usually dentists will take most of the. I'll not use the word most. All the dental clinics in a urban setting will have a intraoral X-ray. So in intraoral radiographs, you can have either a digital X-ray format where the dentist will take the radiograph and it is immediately displayed on the computer screen. However, patient cannot get a copy of it unless otherwise the dentist has a printer attached to that scanner. Okay, and the other one is the conventional radiographic film-based X-ray, and these two usually the dentist will do. And nowadays, I see a lot of Bangalore clinics getting equipped with the panoramic unit because of the cost is coming down, and if the space is available, a panoramic unit can also be there. And otherwise, most of the diagnostic centers do this. It's a 5-minute job. And these two, and along with this occlusal radiograph also, dentist can take. However, for skull views and other complicated views, we need the panoramic X-ray machine kind of a unit. It cannot be done with a small intraoral X-ray unit.
Extremely. So Dr. Subhash, for all the routine dental treatment procedures, generally these are the kind of X-rays and the scans that would be required, and the dentist will prescribe that to the patient and ask him to get it done, so that there is a better understanding about the disease process that's happening there, the extent to which it's happening, so that the dentist can take a call on how to go about doing the treatment.
Yes, absolutely correct.
Okay, okay. So, Dr. Subhash, is there anything else that you would like to add and say, like, any other specialized scans or something that is
Yeah.
available in?
See, with the advent of technology, now we have something called as ultrasonography. Ultrasonography was used for a lot of other purposes like gynecological problems, thyroid issues. So many ultrasonography, most of them would be aware of. But now the technology that is in the form of those probes has improved so much that we have ultrasonography for assessment of muscles of the jaw, wherein we can identify some disorders of the muscle. And in cases of cancers of head and neck, ultrasonography has become one of the initial imaging modality to assess the lymph nodes, okay, lymph node spread of the cancer. And we have CT scans, it's for maxillofacial trauma or any huge cancer or tumor in the facial skeleton. CT scan, and along with that, the metastasis of the cancer
Yes.
can also be assessed with a CT scan. We have MRI scans for head and neck region. It is mainly used for soft tissue pathology, like if there is a tongue cancer, CT scan may not show all the details like thickness of the tumor and extent. So tongue cancer or the cheek cancer or the area of the soft palate that is behind the throat area, that cancer, salivary gland cancer, all these cancers are better visualized with the help of a MRI scan. And also MRI has a very important role to play in the diagnosis of temporomandibular disc disorders, where it is just like any other disc in the body. So it helps. And we have advanced PET scans and PET CT scans, which are used in treatment of cancer as well as diagnosis of cancer.
Cancer. Okay. So, Dr. Subhash, I think that was a very informative talk, I would say, and especially to our patients, who probably sometimes wonder why we would prescribe certain diagnostic, recommendations that we would give. And I really hope whoever our patients are watching this will get a clearer idea of why a certain X-rays or scans would be required by a dentist.
Yeah, I hope they will have a clear picture. Actually, dentist should be, most of them will be explaining these things to them before he advises, but still patient should have this knowledge so that they
Yes.
will not be in any sort of doubt when they go
Yes.
for a
Yes, 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 yes. So, Dr. Subhash, thank you so much that you took your time off and you came onto this platform and shared all your experiences with our patients today.
Thank you, Mom. Thank you. And I hope to return back again because
Yes, yes,
educating
yes,
a patient is
yes,
my, I like
yes,
a lot about
yes,
this
yes,
part.
yes. Thank you. Thank you so much, Dr. Subhash. I hope I can get you back to do another talk with our patients.
Definitely, ma'am. Thank you. Thank you, doctor.
Thank you, sir. Thank you.
Thank you.
So, viewers, that was Dr. Subhash, who did share with us his knowledge and experience and explained to us and told us the importance of X-rays and scans in dentistry. I hope that talk was helpful. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you. And you can contact Dr. Subhash. His contact details are given in the description box below. So until next time that I come back with another expert who will share their knowledge and expertise about your oral and dental health, keep smiling, stay safe, and be happy. Thank you.